Good morning. Welcome to the LeadingAge Virginia Coronavirus Weekly Member Call. Thank you so much for joining us. Hope you all had a wonderful Thanksgiving. We are going to begin with our first speaker, Catherine McCombs, who's going to be talking with us about some legislation that passed during the 2020 special session that will impact our member communities. So over to you, Catherine. Thanks for joining us.
Thank you. Can you hear me okay?
Yes, we can.
Perfect. Okay. So since I can't see the slides, right now we should be at the one that just says House Bill 5048. So thank you for asking me to speak today about House Bill 5048 and how the Virginia Department of Health plans on meeting the goals of the legislation. If you are unaware of the legislation, it requires VDH to make information about outbreaks of communicable diseases of public health threat, i.e. COVID-19, public by name of facility and include the number of cases and deaths associated with the outbreak. The legislation was signed October 21st. Next slide, please. The facilities that the legislation affects are, effects that are not already being reported are these. As you may know, we already report on long-term care facilities and K through 12 schools by facility name. I believe what affects you most with the legislation is the residential or day programs. Next slide, please. This is an example of the long-term care facility outbreak page that is available on the VDH public-facing website. The new outbreak dashboard we are creating will include the new facilities just mentioned and the long-term care facility and schools. The new dashboard will look very similar to this one, but you will be able to choose the type of facility that you want to review. So there will be a toggle for facility type. So if you just want to look at one type, you'll be able to do that. And there will also be a toggle for outbreak status. Everything else will be basically the same. Next slide, please. We will work with the local health districts and the facility to ensure that there are at least 30 residents and staff at a facility. If there are fewer than 30 persons, we will not include the outbreak as we want to protect the confidentiality of the residents and staff. We will also work to ensure that the facility is licensed by looking the facility up on the licensing website. The outbreaks will be reported once a week, which will allow the data time to stabilize and for the local health department to work with the facility to ensure that the most accurate data is available, and so that if the facility wants to notify all of their residents, their staff, or the families of the residents, that there will be some time to do so. If you notice an error on the page when it is posted, then please contact your local health department who did the investigation for the outbreak for clarification. Next slide, please. Lastly, I want to inform you that we suppress case counts less than 5 and deaths between 0 and 5. So if there are no deaths, you will see a 0, but if there are 1 through 4, there will only be an asterisk. If there are 5 or more, you will see that number. In addition, the outbreak status will be the same as the long-term care facility. So an outbreak that is listed in progress is one that is still being investigated. An outbreak that is pending closure is one that has had no new cases reported for 2 incubation periods or 28 days. And an outbreak that is closed is one that has been finalized and no new data will be added. If an outbreak is closed, it is not removed from the dashboard. It is just listed as closed. One of the questions we've had numerous times from the public is, about pending closure and closed outbreaks. And we try to explain this in the language that goes with the dashboard. That does not mean the facility is pending closure or is closed. It just means that the outbreak is. And we try to clarify that, and we just wanted to definitely point that out. This new dashboard, we're hoping to go live on December 21st. And the other point I want to make is that certainly long-term care facilities and schools have been reported for a while. The outbreaks that we will be reporting will be ones that, for the additions, are the new ones that were reported from October 21st moving forward. We will not go back in time. Since the legislation was enacted on October 21st, that's the day we're going to start with any outbreak that was reported to VDH on October 21st and moving forward. I am happy to take questions. You might have to read them to me, though, since I can't see the slides or what chat questions you might have.
Thank you, Catherine. I do not see any questions, but wonder if you could clarify if there are any changes for long-term care that are currently in place. You know, what is the overall impact on our membership for nursing homes and assisted livings related to what is already in place now?
Sure, that's a great question. There won't be any impact. Everything that has been reported will continue to be reported, and as we move forward, the only thing is all of this information will be together in one dashboard. So if you are used to looking at this by going to the long-term care or that task force page, there will be a link to the new dashboard from there. It'll just be moved, and it will include all of this information, all of these other facilities. So you might just have to choose in the outbreak dashboard if you just want to look at nursing homes or long-term care, you'll have to choose that in the toggle. But otherwise, it should be pretty much the exact same information. And for folks who like to look at it on their phone, if you have done that, we're working on modifying it so it's a little bit easier to look at on your phone as opposed to on your computer.
And if a long-term care community has concerns about the data that's being reported, meaning that it may not be accurate, how would they go about getting that information corrected?
Mm-hmm. They will need to contact their local health department, and especially whoever they have probably already been working with to identify and investigate the outbreak, because at the local health department level, they're the ones who put the data into our outbreak surveillance system, so they can work with their local health department to get that information updated.
Okay, great. Well, thank you. I just want to give a last call for any questions before we move on to our CARES Act funding update. Okay, well, hearing none and not seeing any in the chat box. Thank you, Catherine. We appreciate the update. So now we'll be moving over to Thomas Gates, the Senior Advisor for Finance and Technology with the Department of Medical Assistance Services, to talk with us about update related to CARES Act funding for nursing homes and assisted living. We do have a slide for this. Over to you, Thomas.
Thank you so much for the introduction. So the big news here is we sent out updated guidance. It went to our email list that we have that we shared with the last time. So somebody in each of your organizations, basically whoever's listed on your license documents with either VDH or DSS should have an email in their inbox kind of explaining this, but it's also available on our website under the COVID tab. So that's www.dmas.virginia.gov / and then the little pound sign and then / COVID. It's the same place that any other materials you looked at from the last time were shared. So it's all still there. You can still find it. And I think LeadingAge probably is sending some stuff out as well. The big changes are two. First, basically complying with language that was in the, thank you, Dana, complying with language that was in the past budget that the governor just signed. We're extending kind of the eligible period that you can submit expenses for. So the total amount of money you can be reimbursed isn't changing, but if, for example, you did not have enough expenses in the kind of July, August, September timeframe to hit the cap for your facility, you can now go back to March 1st and pull expenses from then forward, basically. So you can say, well, I didn't have enough expenses in August, but I had this unreimbursed expense in March, and that can be added to your cap. So that's one change. And then one change that's maybe more significant for nursing facilities, though I know assisted living facilities are receiving this as well, is a change in how we are treating the provider relief fund money. So we explicitly were not allowing facilities to offset revenue losses. They had to not count revenue loss when they were saying how much provider reimbursement fund they had received. We're changing, and there's kind of detailed guidance in the letter that went out and an updated invoicing sheet. We're now basically saying you can use PRF for anything that's allowable for via HHS's rules. We're not opining on those rules. That's between the facility and HHS. But anything that's allowable under the PRF, including revenue loss, is an allowable use for our purposes as well. And the change there basically would mean you can now come in and attest to us that your expenses that you're submitting have not been covered by any other federal program. And then we will reimburse for them. So the change there is this attestation process where you're able to say, we're confident that the expenses we're submitting to you have not been reimbursed by another federal program, which in almost all cases would be the Provider Relief Fund. And so these are unique expenses that have not been otherwise reimbursed, and then we can reimburse based on that. The documentation stuff hasn't changed. The basic general outline of the process hasn't changed, but that kind of is a change in how we are allowing you to treat PRF. And then the final change is we pushed back. The original final deadline was yesterday. Obviously, with a program change coming November 30th, you can't have a December 1st deadline. So we pushed the deadline back to December 30th. I recognize that's still a very fast turnaround in the middle of the holidays. But given that the CARES Act funding, CARES Act program ends December 30th, absent any action by Congress to change that, we feel like we couldn't push it any further than that. So I'll stop there. Those are the two big changes. Again, the link that Dana put in the chat, and hopefully it's coming out in guidance from LeadingAge, will give you links to the updated guidance and the updated submission templates. They're very, very similar for both ALFs and NFs, but there are two distinct both guidance documents and invoice sheets. And there's a copy of the attestation I mentioned as well. So with that, I'll stop. And if there are any questions, I will do my best to answer them.
Thank you, Thomas. I wanted to mention that in our LeadingAge Virginia update yesterday, all of the links that you just mentioned, the updated guidance for assisted living, for nursing homes, the required attestation, as well as information about the invoice submission workbook are all in our update yesterday. If you need any of that information, please reach out to me and I'll be happy to share it. Do we have any questions?
Thank you for doing that.
Yeah, absolutely. Melissa, are there any questions in the chat box?
No,
Okay.
there are not, Dana.
Okay. Okay, thank you. Okay, well, thank you, Thomas. We appreciate that update and you taking the time to talk with us today. So we are going to move over to our vaccine update. Michael Magner, the Regional Healthcare Coordinator with the Central Region with the Virginia Department of Health. So over to you.
Hey, great, Dana. This is Mike. Can you hear me?
Yes, we can.
Okay, you can. Good. All right, you had me worried there for a second. Okay, so I can't see the slides, but I assume you're on the first slide that says COVID-19 vaccine updates. So as most people have probably heard, Pfizer did submit their emergency use authorization request to the FDA back on November 20th. The FDA announced that there will be a vaccine and related biologics Products Advisory Committee meeting, or VRP back meeting on December 10th to review the Pfizer vaccine efficacy and safety data. Also, the CDC Advisory Committee on Immunization Practices did hold a meeting late yesterday, and as I was putting the slides together, they were meeting, so I didn't have the results to share with you, but Dana emailed out an email basically explaining what the ACIP recommended. And so the big change from their ACIP recommendations from previous is that long-term care facility staff and residents are now included in that Phase 1A category. So originally, Phase 1A included healthcare workers, and Phase 1B included the long-term care facility residents. By moving the long-term care facility residents up to Phase 1A, that actually makes our job from the Virginia Department of Health position a little bit easier, because we can now vaccinate both the healthcare workers and the residents at those facilities at the same time. So that does make it a little bit easier. On the other hand, it does stretch out the pool of people who are qualified under Phase 1A is now bigger. And so we've got, the same amount of vaccine that we now have to stretch out over a bigger group of people. And so it'll take a little bit longer to get through that Phase 1A priority group because of that. We are getting a lot of questions at the health department. What about, people who are healthcare workers but not directly working with COVID vaccine, like psychologists and dentists and all sorts of different people, and what's their priority group? And, the long answer is, we're going to work to vaccinate everybody in that Phase 1A group, and we're going to continue working until we have them all vaccinated. But it's really, if everyone's a priority, then of course nobody is. So that's one of the things that we're juggling with at the state level, and trying to determine which doses of vaccine will go where. Next slide, please. So on a previous LeadingAge call, I briefed you guys on the CDC's pharmacy vaccination program. And one thing that we have done at the health department level is we have ensured that all of our skilled nursing facilities and assisted living facilities in the state are 100% of them are enrolled in this program. This means that when Virginia turns on or activates our long-term care pharmacy program, those doses of vaccine will go to the CVS and Walgreens pharmacies that are contracted by CDC to reach out to those facilities and provide the vaccine to them. And again, states have to activate this program, and the timeline for our activation really is still not completely determined. We do know that any vaccines that we allocate for the long-term care pharmacy program come out of our total state allocation. So when you look at our allocation, we have to look at our healthcare workers both inside and outside the hospitals, our public health and medical reserve corps volunteers, and our EMS responders are all part of that Phase 1A group, along with the long-term care facility. So at some point, when we determine we have enough vaccine to allocate to the long-term care facilities, we will activate this program, and then the CVS and Walgreens will then reach out to those facilities directly to schedule vaccination events. It'll probably be about a 2-week period between when we turn on the program and when the pharmacies are actually able to receive their vaccine and actually go out and start vaccinating people at facilities. Next slide. During those 2 weeks, the pharmacy partners will be contacting the facilities directly to schedule their on-site vaccination events. The pharmacies will provide what we call end-to-end services. So that means they will do all the work in terms of receiving the vaccine, storing it correctly, transporting it out to the site, administering the vaccine, collecting all of the vaccination records, and submitting all of those records into the vaccine information systems of record. And each facility will get 3 visits. And if you look at the next slide, it kind of outlines how those 3 visits are set up. So on day 0, the first day that the team comes out to the long-term care facility, they will vaccinate everybody who has not been vaccinated yet, who's available to vaccinate, and of course who consents to vaccination. Then they will come out either 3 weeks or 4 weeks, depending on which vaccine they're using, because Pfizer is a 3-week between doses and Moderna is 4 weeks between doses. So depending on which vaccine they have, it'll be either 3 or 4 weeks later. They will give everybody their second dose who got their first dose. And then if there's other people present at the facility that have not gotten their first dose, they'll go ahead and give them their first dose as well in that same visit. And then they will come out again 3 to 4 weeks later and administer a second dose for everybody who's only gotten one. And then after that, they're not going to come back out to that facility. So if you still have folks to vaccinate after that, we'll have to continue to work on, how we're going to get those people immunized, probably through some of the other pharmacy provider options that are also coming out sort of in the phase 2 time frame. Or you could work with the local health district to try and get that done. So that's, last slide, some final comments. I do want to caution everyone that the vaccines really don't provide protection until about a week after the second dose. When you look at all of the study data, the little bit that they've actually released publicly, it's all based on their 94% efficacy is based on 1 week after the second dose is administered. So what does that mean? It means that long-term care facilities should continue all of their infection control measures even after the vaccine administration has begun. They still need to complete all of their, weekly testing based on, the local health district and county percent positivity data and all the other data that they're looking at. That part won't change. And it should be noted that the vaccines, or at least the RNA-based vaccines, should not affect PCR and antigen positivity rates. So it would have an impact on, the antibody test if you're running antibody tests. But as far as testing someone for COVID based on PCR or antigen, the vaccine should not affect that. That any positives you see, even among vaccinated personnel, should be treated as true positives. And that's all I have, pending any questions.
Melissa, are there any questions in the chat box?
Yep, there's a couple that have come through, Mike. The first one was, has there been any discussion at the state level to make the vaccination mandatory for long-term care and healthcare workers?
So all of the discussions at the state level have been in, basically in the vein of we're not going to make it mandatory for anyone. We are going to recommend it pretty strongly. But the problem with mandating vaccine is that it actually has it could backfire and result in lower uptake than if we just simply make it voluntary and promote the purpose and the benefits. There are some CDC websites and resources that have come out now that talk about these messenger RNA vaccines and the benefits and the overall risks, and do recommend that people check those out and make informed decisions about whether they get vaccinated. I'm planning to get vaccinated as soon as it's available. I think it's very safe and effective. So I think we're just going to go with the voluntary push and just provide all the information we can.
Great, thanks. And another question that came in was, is there a recommended consent form for staff and residents?
Yeah, so there will be a couple of forms. One, they have to identify, well, consent is something that the facility will identify kind of preliminary ahead of time. I'm not sure if there's a specific consent form. There is going to be the emergency use authorization fact sheet that is given to everyone prior to receiving the vaccine, but I'm not exactly sure if there's going to be necessarily a standardized consent form for the facilities to go out and collect the information from, the residents or from their family members. So I'll have to get back to you on that.
Yeah, and this is Dana. As we work on the vaccine advisory work group through the Department of Health, I have raised this issue about developing some type of template policy that communities might be able to use. And so my understanding is that there is some protocol and some guidance and training that will be developed and placed on this website that I put in for the VDH COVID-19 vaccination response. But that is something that LeadingAge Virginia is continuing to raise with the work group about developing some templates. And then I was on discussions yesterday. I'm a member of the legal committee with LeadingAge National, and we raised this topic as well. So we'll be keeping members informed as we have things developed and can share those.
Thanks, Dana. Another question just came in. Based on this, we do not need to coordinate any other efforts to vaccinate facility staff. The staff are included in the CVS Walgreens plan.
Yeah, so that's correct. So, I mean, as far as the staff are concerned, when CVS and Walgreens come out to vaccinate the facilities, they will include the staff in the plan. That does not mean that the staff are not allowed to get their vaccine from some other source, whether it's from, a healthcare provider or from the health department or some other thing. We're not going to tell people, you have to get your vaccine through this avenue and not through another avenue. But, practically, that may be the best way to get their vaccine, and the quickest way to get it is through this option.
And Mike, how will it be addressed once CVS and Walgreens have moved forward with the initiative and provided the vaccine, and then you have future admissions into long-term care communities, assisted living and nursing homes? What will they need to do in order to administer the vaccine?
Hey, Dana, that's a good question, and that plan has not been fully fleshed out. However, I can tell you that, once we get past, phase 1 and the vaccine becomes more plentiful, there'll be a lot of providers, including all of the major pharmacy chains during phase 2, not just CVS and Walgreens, but all of them, plus, private practices and local health departments that will all have vaccine. And so there will be lots of avenues to pursue that. I just don't have a specific answer for you right now.
I was wondering if you would recommend that every long-term care community that registered for the pharmacy initiative with Walgreens and CVS also sign up to become the provider intent form. If they were to go ahead and complete that, would that allow them in the future to be able to administer it and not have any impact on their registration for the pharmacy partnership?
That is correct. So just because they're enrolled in the pharmacy partnership does not mean they cannot enroll to become providers. And doing so would allow us to ship vaccine directly to them and allow them to vaccinate their own staff and residents in the future.
Another question that came in, for CCRCs, will the independent living residents be included in the vaccinations?
Hey, I'm sorry. Can you define CCRC?
Yeah, so continuing care retirement communities that have multiple levels, nursing home, assisted living, and they also have large independent living parts of their campus. So will the independent living residents be included?
I don't know the specific answer to that. I know that question comes up. And I think originally when CDC was setting up this program, they had every intent to include that group. I think the concern was they had much higher response than they were anticipating. And so after they started to see how many facilities were signing up, they have started to scale back the promise on that. So I can't answer that at this time. It's a CDC program. So more information to follow when that becomes available.
Yeah, and I can actually comment on that. So we raised that issue, and we were advised everyone for communities to go ahead and include their independent living numbers in the red cap form, just so that if it was available for independent living, that they were included.
Those are all the questions that have come in, Dana.
Okay, thank you, Melissa. Any other questions? Okay, well, we're hearing none. We know your time is very valuable, so we will go ahead and end our call. Our next member call is tentatively scheduled for December 16th. So we sent that information out through your calendar, and it'll also be included in our updates, our weekly updates. So hope everyone has a great rest of your week, and we're always here. If you have any questions, please let us know. Thanks so much.